Hello, everyone, and welcome to BJC Healthcare's Facebook Live event. Tonight, we're going to be talking about flu season during COVID-19. This is actually the fourth in a series of Facebook Live events that we've done throughout the pandemic. Some of our earlier topics were talking about back to school and mental health and pregnancy and newborn care during COVID-19. And so thanks for joining us. We hope you find tonight's conversation really useful and really valuable. And I'm joined by two experts to help us out with this timely conversation. First with us is Dr. Stephen Player. Stephen's a pharmacist by training and is currently serving as the Executive Director of Diversity, Inclusion, and Community Engagement at Barnes-Jewish Hospital. Dr. Player, thanks for joining us.
Thank you for having me.
And also here with us is Dr. Caitlin Rogers, a family care physician at Progress West Hospital in St. Charles County. Dr. Rogers, thanks for being here.
Thank you.
All right, so before we get started, we have a couple of questions that were submitted in advance, and we expect others to come in as we're talking. So we do have a team that's keeping an eye on the Facebook feed, so please let us know what you'd like to hear about. Just as sort of a ground rule, though, I think it's important to note that really this evening is not so much about diagnosing medical conditions or really specific information related to you or your care. That it's certainly much more of a general conversation about this topic. But while we are here to answer questions, if you do have a specific question, we do encourage you to reach out to your provider or your physician. If you need help finding a family practice or adult primary care physician, I'm going to read a phone number for you, and I think it's going to come up on the screen as well, and that's 314-675-1047. And then in addition, if you need help finding a pediatrician, someone for your child, there's a referral specialist line at St. Louis Children's Hospital at 314-720-5227. So certainly lots of resources out there, and we do want to make sure that you get good medical advice when you need it. You're also going to hear us talk about a few different websites along the way, so it can't hurt to hear them a few times. You may hear mention a website on BJC.org, BJC.org, Keeping You Safe. That's really become a home of a lot of really important information during COVID-19, talking about how we're creating a safe environment and a safe experience to come receive care at all of our different hospitals and provider offices during the pandemic. There's also a lot of videos and resources for you on that webpage. There's another webpage on the BJC site. You may hear us talk about bjc.org/flu shots, where we have events for our community in the coming weekends where we're offering free flu shots, really trying to reach people who maybe don't have access to a flu vaccination through some other means. And then you're going to hear us talk about vaccinatestl.org. And so that's a website that a number of different health systems and partners in healthcare came together to create a resource for the entire region of where to go to find out about flu shot events, where to find out information about the vaccine, and different health resources that are out there. So that's vaccinatestl.org. So we know that despite the really beautiful weather that we're experiencing in St. Louis right now, that flu season is just around the corner and it's on its way. And so that's why tonight's conversation is really important, because we want to make sure that you're prepared and that you feel protected during this flu season. And so again, we have a lot of different sort of questions and topics to get into. But before we do, I'd love to hear from Dr. Rogers and Dr. Player. What are some things that you're each sort of seeing or hearing, in your practice or in the community as we enter flu season during COVID-19? Dr. Rogers, do you want to go first?
Yeah, absolutely. So like they said, I'm a family practice doc, but I have kind of a unique perspective in that I not only see adults, but I also see pediatrics and I do obstetric care as well. So that gives me a whole span of different populations to work with as a primary care physician. And it really stresses the importance of these flu vaccines for every single population that we're working with. It is a very scary time with the COVID pandemic going on at the same time. But I think if anything, that just reiterates the importance of protecting against the flu. We have a vaccine for the flu. We know a lot more about it than COVID. And we're going to be seeing COVID and flu at the exact same time. In fact, we've already actually started seeing our first few cases of flu here in my clinic, and we're expecting that obviously to only rise from here. And the flu impacts everybody. And I think that's the thing to really stress. The flu season does vary in severity from year to year, but one way or another, it impacts us every single year, no matter what, and has a huge impact on different populations. And that includes the whole span from pregnancy to infants to childs to adults.
Great. Thanks a lot for that. Dr. Player, any thoughts as we kick this off?
Yeah, absolutely. Similar to Dr. Rogers, my experience in the pharmacy space, and particularly the community engagement space as it relates to bringing our flu vaccination program into the community. We've seen in the past that we've done a lot of that on campus at various BJC locations, and even historically taking it out into the community. And this year, because of COVID, obviously, and social distancing needs and requirements, we're not able to do that in-house anymore. So we will be offering up several community-based events, which we'll talk about tonight. I'm sure Michael has some questions for us that can bring that out, and we'll have some infographics up to share with you. But a lot of the questions and concerns that I'm getting and hearing are, will there be enough flu vaccine for everyone? Should I even get a flu vaccine? Will that protect me against COVID? I got a flu shot last year. Do I need one this year? All these questions are coming up. Is it safe for me to receive that flu vaccination this year? What are the different types? And I'm pretty sure we've got a couple of points to hit on tonight that will address all those concerns.
Yeah, that's great. I think you hit on a lot of questions definitely that are on people's minds. So we do want to make sure we get to all of those topics. Why don't we start tonight with really sort of a focus on the flu first? And this is such a dynamic time. This is a flu season that we know we have not seen and experienced before, because we are still living very much through a pandemic. But let's talk about the flu first, and then we'll expand and talk about COVID-19 as well. So Dr. Rogers, would you take this first one, and can you sort of share who is really most at risk for the flu?
For sure. So, similar to COVID, anyone can get the flu, but there are a few populations that are going to be at risk for the flu and at risk for more severe disease with the flu. So as with COVID, and again, we'll talk more about that later, the elderly population or the 65 plus population, they are definitely going to be at risk for having the flu and more severe disease associated with it. The pregnant population, they're at very high risk for the flu as well. Young children, especially those under 2 years, and that really stresses the point that children under 6 months old cannot have the flu vaccine. So it's our job to protect them as well. We also have to take into consideration anyone with chronic health conditions, and this can be diabetes, this can be heart disease, cancer, asthma. This also includes people that are on immunosuppressing drugs for things like rheumatoid arthritis, for example. So this is a huge amount of our population that not only can get the flu, but can be very severely impacted by it and end up in the hospital with very severe disease.
And I think you touched on a really important point there, that when you receive a flu vaccination, you're not just doing it for yourself. You really are doing it for the community, and noting children 6 months and younger, especially who are particularly vulnerable. So yeah, thanks for sharing that, Dr. Player. As we're just on the cusp of the flu season, and Dr. Rogers shared that you're already seeing patients in your practice. How long does the flu season typically last in a given year?
Absolutely. Typically, we see the flu season kick off right around this time, as you mentioned, Michael, late fall into early spring. So there's usually around an 18-week or so time period where flu is at its most heightened prevalence across our communities. And so, which is why we typically kick off our flu campaign in October, so we can maximize the protection of those individuals who receive the flu shot. And that should cover us pretty much through the flu season into the early spring.
So, Dr. Rogers, what are some of the symptoms of the flu? And there's obviously we can talk about it in the context of COVID-19. We can talk about it in the context of seasonal allergies. What should people really look for?
Absolutely. So with the flu, the vast majority of the time, you do see kind of these classic symptoms that you hear described. So those are going to be fever, chills, body aches. A lot of people will have cough, sore throat, headache, just overall general malaise and fatigue. If you're looking at kids specifically, they are a little more likely to have some of the gastrointestinal type of symptoms like vomiting and diarrhea. Adults can have these too, but you see them more commonly in kids as well. And I believe we have a chart pulled up here that is actually really, really helpful that compares flu, the cold and seasonal allergies, and it also throws in the coronavirus as well. So as you see, a lot of the symptoms between flu and coronavirus do overlap, particularly like the fatigue, cough, and fever. But then also with coronavirus, you're throwing in the loss of taste and smell. And a lot of times with COVID, you are seeing those symptoms that you would see with the flu, but kind of on the next level. They can become more severe more quickly, particularly in regards to cough and shortness of breath. But this table has been a go-to. I've printed color copies of this for my patients to hand out because it is going to be complicated this season trying to figure everything out. But I think this is a good go-to if you're starting to feel some symptoms and trying to distinguish between what may be what.
Yeah, we've certainly shared that table in social media, and we'll continue to do so. It is a helpful reference. Dr. Rogers, why don't we stay with you on this next one? Can we talk about how the flu is spread, and will you give us some context relative to COVID-19? Is it similar? Is it different?
So in many ways, it's similar. The primary means of spread is going to be via respiratory droplets. So things like sneezing, coughing, talking in close proximity, singing, things like that. There is some degree of spread that can occur by direct touching, such as shaking hands or touching the same surfaces. But by and large, it is going to be through respiratory droplets. So a lot of the same measures that we're taking to protect against COVID, such as masking, hand sanitizers, social distancing, ideally should help with the flu too.
Got it. And another question, sort of staying along those lines, is related to COVID-19. We talk about how people can be asymptomatic with COVID-19 and still pass it to someone else. Is that the same with the flu? Do you have to be experiencing symptoms to be contagious?
So there is a little bit of a subtle difference between the flu and COVID when it comes to this. With the flu, you can be contagious about 1 day, give or take, before you become sick. And then again for about 5 to 7 days after you become sick, and sometimes even longer than that. You're most contagious with the flu and usually about the first 3 to 4 days after symptoms begin. With COVID, what we're seeing, and again, we're working on gathering more data about this, you can actually be asymptomatic for a little bit longer than with the flu. So maybe like 3 or 4 days versus 1 day. And you can be contagious for longer, which is why we've been using the 10 to 14 day guideline for quarantine, whereas flu seems to be just a little bit shorter. So we are seeing some differences there. And again, there'll be more data that comes out as we go along too.
So what should someone do if they get the flu? How do you treat it? How do you manage it?
Absolutely. So the flu is a virus. So therefore, it's not going to be a bacterial type of infection that we give you antibiotics for. And a lot of it depends on when you present with symptoms. So say you go to your primary care within 48 hours of symptoms beginning. At that point, you would be a candidate for an antiviral therapy. And there are several. Probably the most common one that people have heard of is Tamiflu. But for most people, that needs to be given within the first 48 hours of symptoms. There are some exceptions there in that if someone is immunocompromised or has exposure to high-risk populations, they can be treated beyond that. Or if they're in the hospital, they can definitely receive Tamiflu. But in a lot of cases, particularly if it's been more than 48 hours since you've had symptoms, we're going to treat it in what we call a supportive way. We're going to have you get lots of rest, stay really well hydrated, use things like ibuprofen and Tylenol to help with the fever and things like that.
Great. And so why don't we talk about, we talked a lot about the flu and symptoms. Let's talk about how we prevent the flu for a little bit here. And we're talking about the flu vaccine. Just right out of the gate, Dr. Player, why should someone get the flu vaccine?
Absolutely. As we heard from Dr. Rogers, it's the best way to prevent not only yourself from catching the flu, if you will, but also to protect our community and those loved ones around you. The vaccine we've seen, it's been proven to lessen the impact, the possibility of contraction of the flu virus, and especially during this time where we know there will be a twin pandemic that's happening. We will be experiencing flu and COVID at the same time. So how do we best maximize our own protection and that of everyone around us? And the best way to do that is not only through the social distancing, hand washing, and the other efforts that we've been promoting, masking with COVID, but a flu vaccination will definitely help to reduce that.
So we received a question that was asked in the Facebook feed that I have heard it asked, and I've asked it myself, and so it's a great one to keep going with. Does the flu shot give you the flu? Dr. Rogers, what's your response to that? How can we answer that question?
And that is a question I get all of the time. We do have various forms of the flu vaccine, but none of them give you the flu. They are designed in a way that they cannot directly give you the flu. Probably the thing I see most commonly is the reaction that people have as their body is developing that immune response to the flu. So usually after giving it, they can feel a little more tired, sometimes have some body aches, but that is simply your body building up that immune response. One thing I would like to point out as well is, no vaccine is ever 100%. But when you get the flu vaccine, there are countless studies that show even if you were to get the flu during flu season, by having the flu vaccine, you will reduce the severity of your flu illness. It will reduce the amount of hospitalizations, which is huge, and that occurs in all populations. They've looked at kids, they've looked at adults, they've looked at the elderly population. So even though you may get the flu after having the flu vaccine, not as a cause of the flu vaccine, it will reduce the severity of the disease.
Thanks so much for that question. So please keep them coming. I assure you that if you're watching and you have a question, that there are hundreds of others who have the same one. So thanks for asking on behalf of everyone. How about another frequent question that we've heard? And Dr. Player, why don't you take this one? Will the flu shot cause autism? That seems to be a topic that circulates as well.
Yeah, that's based on a historical myth, if you will, and it's been proven through the federal regulatory bodies and tons of research that no, the flu vaccine will not cause autism, nor will other vaccines. It was concerns in years past that the preservative used within these formulations, and more recently thimerosal, which is a mercury-based preservative, that would cause autism or some type of negative impact on mothers who are pregnant, right? And so that has been proven false. So if we were doing the news station fact checker, that would be a false accusation.
All right. Well, thanks for clarifying that one up. Let's see. A number of good questions have come in. Dr. Rogers, you touched on it earlier, and it was in the context of the age of people who should receive the flu shot, and even those who are most vulnerable. Would you spend a little more time talking about both with your very youngest patients as well as our very oldest patients? Is there anyone again who should not get the flu shot? Is there anyone who really needs to make sure that they receive a flu vaccine? And then even are there differences in flu vaccines depending on how old you are?
Absolutely. That's a great question. So the vast majority of the time we are giving the inactivated quadrivalent vaccine, and that's the vaccine that anyone between the years of 6 months and 65 years will get. And again, Dr. Player, you can play in on this too with the different types of vaccines, but that's by and large the one that we're going to give to most people. Now for the 65 plus population, we actually have a high dose flu vaccine that is designed to provide them additional coverage. And so for anybody who's 65 plus, we do recommend that high dose vaccine. There are actually not very many contraindications to getting the flu shot. So there's not very many people who cannot get the flu shot. Obviously, like I said, no one under 6 months old is currently approved to get the flu shot, so it's our job to protect them. And obviously, anybody who has had a severe life-threatening allergy to the flu shot, such as anaphylaxis, should not get the flu shot. There are a few cases of things like Guillain-Barré syndrome, which is a neurologic disorder, where sometimes the flu shot is not indicated. That is not always the case, though, so that's a decision that needs to be made between you, your primary care physician, and perhaps your neurologist as well. One question I get a lot is about egg allergies, and again, Dr. Player may be able to play in on this as well. But egg allergies in general you're actually able to get the flu vaccine in most cases. They've determined that the amount of egg protein that is in some of the flu vaccines is typically not enough to have a reaction to. We do have egg-free versions of the flu shot, however, for those who do have a reaction.
You hit them all on there, Dr. Rogers, absolutely. And typically we've seen individuals who have not been able to receive flu vaccines due to true allergies, to your point, or individuals that historically have had an allergic reaction to the flu vaccine itself. Those who've had severe egg allergies, and to your point, there are vaccination formulations that are egg-free, right? Flu Block is one of them. And then the other in the past has been latex allergy. So if you are not using the formulations like we use during our flu campaigns, and you're drawing up through multi-dose vials, there is a potential cross sensitivity because of the stopper in there. So, but for our events, we have all those are not an issue, right? Because we have the individual dosage that are available for patients that even with latex allergies, because there's no latex associated with it.
Great. So yeah, along those lines, what questions should someone maybe ask? If they go to a retail pharmacy, for example, to receive a flu shot versus a physician who they have a longer term relationship with. What questions, if it's maybe someone's first flu shot or they haven't received one in a while, should they think about or at least be comfortable asking?
Dr. Rogers, you want me to jump in? This is.
I'll let you have this one. I have a couple things to chime in afterwards, though.
Yeah, so if it's the first time they've ever received it, and they need to make sure that they check with their primary care physician to make sure none of their allergies are impacted by that. But I would be asking, is this an egg-free formulation? Is this latex-free? Right, and if depending on your allergies, some individuals really do have allergies to preservatives. So is this a preservative-based flu vaccine, or is it a preservative-free? Are the main questions I would be looking to ask.
And then the couple things I was going to mention along the same lines is for our little ones. So the first time that they ever get a flu shot, it is actually going to be a series of 2 shots 1 month apart. So if you're at your primary care or your pediatrician with your baby and they say, okay, let's give you your flu shot and then we'll get you scheduled for your second one, it's because we vaccinate twice with the first flu shot ever. From there on out, it's going to be once a year, just like everyone else. The other population I don't want to forget about either is our pregnant population. And that both the CDC and the American College of Obstetrics and Gynecology have both said anytime during pregnancy, get the flu shot. At one point in time, there was some question over whether to get it in the first trimester or not, but they've proven that to not be the case. And they've determined that the risks of flu during pregnancy are much, much higher, enough that you should get your flu shot at any point in time during pregnancy.
Great. What about timing? Is there an ideal time to receive the flu shot, Dr. Rogers? Is it ever too early? Is it ever too late?
So most of the time, we are going to recommend starting to get the flu shot around the September-October timeframe. That being said, if you miss those dates, as long as the flu is circulating, you should get the flu shot. So if life happens, if you miss it and it's December or January already and you haven't had it, you should still get it. The flu season can extend into May. And so you want to be able to offer some degree of protection, no matter how much of the flu season that will be through. So anytime the flu is circulating, get the flu shot.
Dr. Player, anything to add there, just as far as sort of timing and encouragement?
No, Dr. Rogers hit it right on the head. But one of the things I also wanted to add to the previous question around what questions to ask, whether it's retail or for individuals where it's your first time receiving the flu shots, a lot of, especially the pediatric population, would like to receive the nasal formulation of the flu vaccine. And as Dr. Rogers mentioned, the injectable formulation is all with a killed virus formulation. Our nasal formulations are using a live virus formulation. So if you're not completely healthy, right, if you are maybe exhibiting any signs or symptoms of fever, you are not a candidate for that. You have a greater propensity for displaying signs similar to the flu, right, after receiving that vaccination.
And so what about locations? I mean, can you really, Dr. Rogers, get a flu shot anywhere these days? Is going to a retail pharmacy the same as going to your physician's office or anything in between? Where would you sort of guide people to go if they've never received one before?
Absolutely. So the vast majority of insurances are going to cover flu shots, and you can get those through your primary care clinic, but you can also utilize your retail pharmacies to have those completed, such as Walgreens or CVS or your local pharmacy. And again, like I said, most of the time insurance is going to cover those. And so you'll have plenty of options. A lot of times you can look for, there's just different advertisements along the road, plus the resources that we've been posting here for various locations for flu shots. Dr. Player, I don't know if you want to comment on some of the free flu shot availabilities, if by chance someone doesn't have insurance or doesn't have a primary care doc at the moment.
Absolutely. And thanks for that tee up to promote our BJC flu vaccines. And also we'll share during this broadcast as well the Vaccinate STL, where you can go and learn about all the locations around the community where you can receive your flu shots. But BJC is providing free flu shots across the community this year. We had our first events occur last weekend down here in the Cortex region, which were drive-through. And then this weekend, actually on Saturday, thanks to a partnership with the St. Louis Blues, we will be administering free flu shots for anyone who walks up down at the Enterprise Center. So super excited about that opportunity. Access to the Enterprise Center, we all know, is either by Metro, and parking will be available thanks to St. Louis City. And then the following weekend on both Saturday and Sunday, through a partnership with the Urban League of Metropolitan St. Louis, we'll be having 2 additional drive-through flu campaigns that are free to the public. One on Saturday, October 24th at the Jamestown Mall location, and then the second on Sunday, October 25th at the Urban League's new headquarters in the old Sears building off of Kings Highway in Auburn. So super excited to be able to provide those. Anyone is welcome. No appointments needed, no insurance needed. And we are vaccinating from 6 months on up.
Yeah, some great partnerships to really bring those events to life. And, I think it's important to note that, free flu shots for our community, that's not a new thing for Barnes-Jewish and for BJC. It's just that we've had to be a little more creative in how we administer them this year. And, because of COVID and taking safety precautions, where we used to invite people to our hospital campus to receive their flu shot, we're going out into the community this year and keeping everyone safe along the way. So, yeah, we're excited to do that this year.
Yeah, I would be remiss if I didn't mention that our flu campaign this year, as in the previous 15 or 16 years, would not be possible without the gifts and contributions from the Barnes-Jewish Hospital Foundation. They have been tremendous in rallying funds to be able to provide those services to our community. And it's a commitment that has been going for some time now and means a lot for our community, especially, as Michael said, for those individuals who may not have insurance or may not have access all the time to get down here to the academic medical campus. We will be in the community across in several locations. So a big shout out to the BJH Foundation for that support.
Yeah, thanks for the support and the important program. One technical question I wanted to ask before we move on from vaccines. This came in via Facebook, and it's a question related to brand name flu vaccines. Fluad. Here I'm gonna show that I think our audience is more knowledgeable than I am. So if I mispronounce it, you can correct me. And that and the high dose vaccine, is there a difference between brand name vaccines and others, Dr. Rogers?
And Dr. Player, again, you can chime in on this.
I can hear my pharmacy colleagues saying, come on, Player, let's get it right now.
Right,
so
right.
I look at vaccines similar to any medication that we administer or distribute, right? You're always going to have your brand names and you're always going to have your generic names, and they're just as efficacious as the other. So it just depends on who is providing the vaccine, which distributor or which manufacturer they were able to secure vaccines from, and which is why it's important, back to the question you asked earlier, depending on if you're a new patient never having received the vaccine or if you have allergies, that you ask those specific questions. Is this an egg-free formulation? Is this a latex-free formulation? Anything that may be contraindicated for you based on your allergies. But yes, they're all just as efficacious as the next. And that's why they go through the rigorous FDA approval before they reach market.
And you'll hear similarities with every single vaccination, including the ones that your kids and teenagers are getting. So, for example, there's multiple brands of the meningitis shot, but they all do the same job.
Yep.
All right, let's talk about how this is going to be a unique flu season. Again, in the midst of a COVID-19 pandemic, and a really excellent question that we received via the Facebook feed that I wanted to make sure we didn't overlook is that this flu season is different because last year we didn't have the word social distancing in our vocabulary, and masks were not a common accessory, which raises a really important question, right? If masks and hand hygiene and social distancing are all in place to help protect us from COVID-19, and they're transmitted the same way, if someone wears a mask and keeps their distance, do they really still need to get a flu vaccination this year? Dr. Rogers, did you want to take that one?
Yeah, absolutely. So I would still recommend getting the flu shot no matter what. And the reason I say that is because the severity of the flu varies so much from year to year. There are some years where it's not nearly as severe, and there are some years where it has a giant impact on our society. If we have anybody that likes data and statistics out there, so looking at kind of the years 2010, 2020, if you were to take the average impact of the flu, the number of illnesses can impact anywhere between 9 and 45 million people. The number of hospitalizations has been anywhere between 140 and 810,000. The number of deaths, that has varied from 12 to over 60,000 people per season. And we do our very best to find a flu vaccine that's going to protect against the most likely strains that will be out there. And again, there's kind of a complex algorithm that goes along with that. But there still is some degree of unpredictability because viruses like to mutate and do different things. So yes, social distancing, masking, all of that should ideally protect against the flu too. But let's add an extra degree of protection and get that flu shot. And that will reduce those numbers even more.
So if we could stay with you on this follow-up question, flu seasons tend to vary in their how mild or severe they are. Are there any signals? Do we have a sense of what this flu season may look like?
And that's a good question I've been getting a lot too. Sometimes we will start with looking at Southern Hemisphere data because they have the flu season before we do. So for example, like Australia, and they this year did have a fairly mild flu season. We need to take this with a grain of salt, however, because like we've been talking about, it's a very different flu season than normal. We've been masking, we've been social distancing, and it also looks like the vaccination rates in the Southern Hemisphere were pretty high as well. So that could very well be the reason that they had the milder flu season as well. So we're hoping for that, but we cannot rely on that. We still need to take every precaution possible to try to prevent the flu.
Sure, and since they're both respiratory viruses, Dr. Player, is it possible to get the flu and COVID-19 at the same time, or is it one or the other?
So, and I will phone a friend in case I get it wrong with Dr. Rogers, but absolutely, they're two different viruses, and you can contract both, which is the heightened sensitivity and concern in the health field across the country and the world. This dual pandemic scare is real in terms of, being diligent in our social distancing and our hand washing and all these strategies that have been promoted, as well as getting the flu vaccine early so you can protect yourself from that fashion. So yes, there is a likelihood, and we're learning now, we're seeing cases show up where individuals are contracting both influenza and COVID.
Mm-hmm. And to drive that point home, the same populations that are at risk for severe illness with COVID are the populations that are at risk for severe illness with the flu. So that is looking at the chronic health conditions, that's looking at the 65 plus population. So this is a population that's already at risk for one or the other. And our prediction, and we're starting to see data here, is that if we put COVID and flu together, it's going to make that infection much, much more severe.
Is there any chance? Oh, go ahead, Dr. Player. Did you have something to add there?
I was just co-signing. Absolutely.
So since we are talking about viruses, is there any chance that the flu vaccine could also have some protection measures against COVID-19?
Two different viruses. Even in the flu vaccine itself, there are typically three types of viruses that are covered, and those, which is why you need to get annual flu vaccinations. The coverage for your vaccination is short. Your body is resistant and are resilient, and so are viruses. So they mutate every year, and so the CDC tries to incorporate the coverage for those viruses that they have seen are most prevalent for the season. And so, yes, you would definitely need to get both if both are available.
And so just to make sure everyone heard that point, Dr. Player. So if you receive a flu vaccine now and a COVID vaccine is available during this flu season, are you able to get both in the same season?
Yes. And individuals have asked before, especially during our community campaigns in the past, I think I got a flu shot earlier this year. Should I get another one right now? Or I think I may have gotten a flu shot, a month ago, but I'm not certain. Will it hurt me to get a second flu shot? And the answer to that is no, it would not hurt you in any way to get a second vaccination. Got it.
Great. Let's see some other questions that we have here. Is it possible? I want to come back to the symptoms again. Is it possible to have the flu without having symptoms of COVID-19 at the same time? I want to make sure that we're really helping people understand that when they're not feeling well, what are the signals that we should be looking for? Dr. Rogers, did you want to take that one?
Absolutely. And if we can pull that chart up again, that would be really helpful too. So it is going to be more complicated this year to tell the difference between flu and COVID, because a lot of the symptoms do overlap. But what I would say is with COVID, we're going to be looking for a higher degree of shortness of breath. And again, a lot of times that loss of taste and smell. So there are going to be some overlap in the symptoms. But the way I've been describing it to people is you have your normal flu symptoms that we've talked about and that are listed in this chart here. But in general, and I can't say this is the case all the time, but in general, the COVID symptoms are becoming more severe more quickly in most patients. And so there are going to be a lot of instances where, yes, we're going to have to test you for both flu and COVID at the same time because it's going to be difficult to distinguish between the two. But if you become very, very sick very quickly with shortness of breath and loss of taste and smell, we would start to lean a little more towards COVID. But for example, I had someone today who I did a video visit with who was talking about very similar symptoms between COVID and flu. We went ahead and tested her for both, because if we're able to rule one out, then that gives us the answer on how we want to take care of her too.
And so, if I can say with you a question maybe for parents, as kids are starting to get back into school, and a child maybe wakes up and isn't their best self, some sniffles, something else. How, as a parent, do you weigh the decision about whether or not to send your child to school that day?
That's a great question, and it's one that we're getting all the time right now with both daycares and schools. So one of the main things you're going to look for is fever. You're also going to look for that cough as well, because kids are going to have those just like adults. But if they have a fever, they need to be evaluated. We're not going to know exactly what's going on, and it's very difficult because, as you know, kids bring home lots of little viruses and things all the time. They usually stay sick from about October to April. So there are going to be a lot of cases where they are more allergy-like symptoms, like what's in that chart. But if they develop a fever, particularly if they have any respiratory symptoms along with it, they need to be pulled out of school and evaluated before we can send them back.
Do you have any advice for parents on what their child should do as soon as they walk in the door every day from school that can help out?
Yeah, so I'm recommending just kind of standard precautions, and this goes for adults who work in healthcare too, or any sort of type of workplace where they may be exposed. So when they get home, have them change clothes, have them wash their hands. I would have a few different masks on hand so that you're able to routinely wash those, because they've probably not been wearing them appropriately, or they put them different places where they're not supposed to. So kind of have this routine when you come home and walk into the door, walk into the mudroom, where you have them change clothes, have them wash their hands, have them turn their masks over so they can be washed. And yes, it's cumbersome and it takes a lot of extra work, but it's little things like that we can do to just give them that extra degree of protection.
Sure, I think every bit helps, and outside of COVID-19, there's still plenty of things that they can bring home from school. So
and they do.
I think we all have a heightened sense of awareness this season for those symptoms for ourselves as well. And so, I mean, hopefully for those of us who are going into the office, that we're also more self-aware of our own symptoms. And we have the stories every year of the the colleague who tried to tough it out and come in when not feeling well, and and others in the office now have a cold or the flu. I think the conversation is so different because of COVID-19. And so any guidance for adults as well. I mean, we find ourselves sometimes out there trying to tough through how we're feeling too.
Yeah, this is not the year to play the hero. If you're not sure, if you're not feeling well, stay home, contact your manager, to contact Health Doc, contact your primary care doc, and figure out what those next steps are going to be. I would say the vast majority of primary care clinics do have an algorithm in place to go through your symptoms with you and determine if you do need to be tested and do need to stay home from work. A lot of offices, most BJC offices included, are having video visits too. So even if they're not able to directly bring you in for an office visit, we can chat with you over a video interface to talk about your symptoms and talk about what's going on and determine what that next plan of action is going to be in terms of testing.
So 2 ways to help your community is 1, to get a flu shot, right? 2, stay home if you're not feeling well.
Absolutely.
Yeah. Along with masking and social distancing.
Mask, hand wash, social distancing.
Everything else that comes with it.
Yes.
Everything. So a question, if you have not received a flu shot before, does it hurt? If you're shot averse, if you're not someone who feels very brave getting a shot, is this something that's a painful experience? What's the advice out there?
Everyone's pain tolerance is different. So to say, it's not going to hurt, someone will come back and say, you told me it wasn't going to hurt, and that felt like the worst thing that ever happened to me, right? And others will just, take it and keep moving, right? So It is an invasive procedure, right? So it is a needle that is involved that goes into your intramuscular space. And so, yes, for some people it will be a degree of discomfort, and for others it may not be.
And some people may never know that they got the shot an hour later. And also normal, though, is to have a little bit of redness around the shot site and to also have a sore arm that day. That's still very, very normal and not considered an actual reaction or allergic reaction to the shot.
Yep. And Dr. Rogers can correct me if I'm wrong here, but oftentimes we encourage individuals, especially during flu season, to take your vitamin C daily, and even before you get your flu vaccination. Some individuals may take Tylenol or Motrin before and or definitely after if they're feeling any type of soreness, redness, or malaise, if you will.
So it sounds like that's go ahead. I was going to ask a follow-up question, but go ahead.
Oh, I was just going to say, the evidence is varying on like what to do before shots. That includes with kids. That's probably one of the most common questions I get is, should I give my kid Tylenol before their shots? There's no right or wrong answer. We don't know for sure that it helps, but in most people, it's not gonna hurt anything. And I also have people ice their arm afterwards if they're worried about some degree of soreness.
Mm-hmm.
So Dr. Rogers, you both mentioned sort of some of the typical reactions to a flu shot. When is it not a normal reaction? When's it worth calling your physician to check on something?
Absolutely. So kind of like what we had talked about, the redness around the site, the sore arm. I also mentioned earlier feeling a little run down, perhaps a low-grade fever, feeling more tired for about 24 hours. Those are all considered normal reactions. What would be abnormal would first of all be a severe life-threatening allergy. So any sort of respiratory involvement, feeling as if your throat's closing, your tongue swelling, things like that. That is not just a call to your primary care doc, that's a trip to the ER, no matter what. Things that kind of come into question would be if you were to develop, for example, hives throughout your whole body after a flu shot. That would be a much more borderline potential reaction that we would need to discuss and probably go ahead and treat you with things like Benadryl. But we're looking more for the extremes. So any signs of respiratory involvement would be indications for immediate evaluation. And again, that is super rare.
And would you find, Dr. Rogers, as we have experienced in the past during these events, both on campus and off campus, that anytime you're going to have a severe reaction, anaphylactic type reaction, as you described, that typically that happens within the first 30 minutes after receiving the flu vaccine?
Yes. Chances are you are not even out of the pharmacy or out of the office before that happens. So if something is going on 24 hours later, it's much less likely related to the vaccine.
And so, Dr. Player, with our community events coming up, can you tell us about some of the safety precautions that we've put in place for people who are either walking up to the Enterprise Center or driving through to receive a flu shot? Maybe it's their first flu shot, maybe they've had a reaction in the past. How are we going to help keep everyone safe?
Absolutely. We have the proverbial first aid stations with EMT and EMS workers, and not to mention all of our vaccine administrators are nurses, right? So clinically trained nurses to be able to manage any type of incidents that may arise. And so for individuals who it is their first time or have heightened sense of concern, or that we may feel as though that they need some monitoring after administration, we have stations set up at each one of our locations to ensure we have that monitoring period to take place.
All right. Well, hopefully we didn't make the flu shot scary in the last couple of minutes, but it's important that we really talk about all aspects of it and really try to make sure people are informed. So why don't we have a few minutes left, so I'm going to kind of bring it back to a close. And so any sort of final thoughts, whether it's related to the flu, whether it's related to flu season and COVID, vaccines, or anything and everything in between. Dr. Player, would you like to share some closing thoughts with everyone?
Yeah, certainly just to continue to promote advocacy around getting vaccinated for yourself and for others around you. I wanted to quickly just dispel the myth that may be out in some communities that the flu vaccine is some experimental vaccine being used to test on the general public. The vaccine has been around for decades and has been studied, researched, and approved annually by the FDA, CDC, and federal regulatory bodies. So that is not the case. You are not a test patient coming in to receive an experimental vaccine.
Dr. Rogers, any thoughts?
Absolutely. So just reiterating all of that, and then just stressing everything we've talked about so far. So the flu impacts everybody, and it's going to be a very unique flu season in that we have COVID at the same time. And like we've said, you still do need to protect yourself against the flu because we have COVID at the same time. And we don't know exactly what it's going to be like dealing with both. The other thing I always tell people is if you're hesitant to get the flu shot, think about the people around you. Think about your friends. Think about family, babies under 6 months old, all those other people that you need to protect. And so even if you yourself don't want it, I would strongly recommend getting it to protect other people. Even for my pregnant gals, you're giving your unborn child some degree of immunity from the flu just by getting the flu shot. So it starts from before baby's even born in terms of protection for flu. And like Dr. Player said, we know a lot about the flu. We know a lot about the flu vaccine. And it's been proven time and time again to prevent the flu. And even if you were to get the flu after having the flu shot, reduce the severity of it and reduce hospitalization rates.
Yeah, so I think the message really is that we are all in this together. So thank you everyone who joined us to watch. Thank you for the questions. Thank you for your interest in this topic. Thank you for sharing what you've learned with friends, with family, with neighbors, and really not just getting the flu vaccination yourself, but also encouraging others to do so. I'd like to thank both of our experts for joining us tonight, Dr. Stephen Player and Dr. Caitlin Rogers. I really appreciate your time and your insights. I certainly learned along the way, and hopefully everyone who watched did as well. So appreciate you joining us. And for everyone watching, as we continue to have these conversations, if there's a topic that is of interest to you, we really want to hear from you. And so let us know what's on your mind. What are some future topics that you'd like to have our experts discuss, and make sure that your questions are answered. So from everyone at BJC Healthcare, we appreciate you spending time with us today, and have a good evening. Take care.
Thank you.
Thank you.